Today we're covering the top 3 signs that you or your child might need braces or Invisalign, and they're not what you think. I'm Dr. Sean Carlson here at Simple Orthodontics in Marin County, California, and we're going to go over the top 3 reasons why your child or you might need tooth alignment, might need orthodontics. The first sign that your child might need orthodontic intervention has to do with foundation alignment. And this can be a little bit tough to see, but if you're a parent looking at your young child's smile, you're going to see foundation issues in the sign of irregular alignment of the front teeth. So in particular, young children, 2nd, 3rd, 4th grade, the top front 2 teeth are not going to be in good positions. The lower front teeth may be erupting overlapped with their neighbors. They might not be in perfect alignment. These are often signs of foundation issues. Foundation issues usually have to do with what we call the transverse dimension or the width of the jaws. In particular, this is most often an upper jaw problem. The upper jaw usually doesn't develop to its proper width, and that causes all kinds of problems in tooth eruption and bite relationship of the lower teeth. These are things that your orthodontist can identify very quickly, so it's important to get your child in to get a screening to see whether or not your child has foundation issues. The second sign that your child may need orthodontic intervention is crowding. Most of us see that in the form of irregularity or malalignment. And your child might be at any stage of dental development, but if you look at the front teeth, you're going to see that they're overlapped with each other. Now, crowding issues usually cause irregularity, which is what most people think of when they think of crooked teeth. Crooked teeth is not something that is normal, and it's usually the result of crowding. It means there's not enough room in the jaws for all of the teeth to fit. So what does Mother Nature do? She overlaps them in order to have them fit with their neighbors. Now, the natural relationship of teeth is perfectly aligned. So if the teeth aren't perfectly aligned, if there's crowding and overlap of the teeth, it usually means that there's not enough space in the jaws. Oftentimes, this goes back to the first point, which is a foundation issue, but if you notice crowding, it is not a natural situation of teeth. So if your child has crowding, overlap of teeth, top or bottom, it means they need orthodontic intervention. The third sign that your child needs orthodontic intervention is a bite problem. And this comes in many forms. It can be back to front problems or side to side problems. But if the top and bottom front teeth are not fitting together properly, your child will benefit from orthodontic intervention. Sometimes this is what people call buck teeth, where the top teeth are a lot further forward than the bottom teeth. And that type of relationship can lead to problems with how they function. So if the bite is not right, if the top and bottom teeth are not in harmony, it leads to problems down the road, and it also leads to smiles not being properly aligned. So leave it to your orthodontist to explain exactly what bite problems are, but the earlier we intervene on these problems for children, the better and more stable the result. So check out our other videos on orthodontic timing and when you should intervene with your child, because early screening is essential to get the best result out of orthodontic intervention. Now let's move to you. What are the 3 signs you might need orthodontic intervention? The very first one is you've had orthodontic relapse, which means you had orthodontics as a child, your bite was aligned, your smile was aligned, and your teeth have moved again. Usually this is a result of you not wearing your retainer. The earlier you catch this, the earlier you should see the orthodontist and the easier it is to solve. So if you've stopped wearing your retainer, whether that's in college, in your 20s or 30s, and you have some teeth that are moving, get in to see your orthodontist, because those problems are very easy to fix. I always like to say orthodontic alignment is one of those things that you need to monitor your entire lifetime, but the earlier you stay on top of it, the easier it is to treat. So if you notice relapse, if you've had orthodontics, your teeth were once straight and they're not anymore, see your orthodontist. We can fix those problems very easily. The second sign you might benefit from orthodontic intervention is you're not happy with your smile. So if this is something that you look at your smile every day when you're brushing your teeth or checking yourself out in the mirror in the morning, and you look at your smile and there are things you don't like about it, it's a good idea to get an orthodontist to evaluate whether alignment would benefit your smile. Sometimes it's just one tooth that's out of position that straightening it will really improve the overall smile aesthetics. Sometimes those solutions are very simple. So if you look at your smile every day and it's something that has always bothered you, that you want to see improvement, see your orthodontist and we'll be able to give you options about how you might benefit from orthodontic intervention. The third and final sign that you might benefit from orthodontic intervention is you've been talking to your restorative dentist about considerable smile restoration, which means you're going to do lots of restorative work on the front teeth to improve the overall aesthetics of your teeth. A little bit of orthodontic movement before you go into the restorative phase will really improve the final results. So oftentimes we work with restorative dentists to do a little bit of orthodontic positioning before you get your final restorations on front teeth. And this is a big one because it is something that's very easy to do orthodontically, but it requires a relationship with your restorative dentist. Now, one of the things that you will find I did not mention in this video is if someone tells you you're going to lose your teeth unless you do orthodontics. I've been treating patients for over 25 years, and that is just not something that is true. I have seen lots of patients with malocclusions and problems where the teeth are overlapped, and they will keep their teeth forever. So even though it's one of those things that I know us dentists say all the time, it simply is not true. People with crooked teeth, people with bite problems, do not always need orthodontic treatment. And doing orthodontics does not mean that those teeth are particularly going to last longer than if you don't do orthodontics. Yes, there are health benefits to ideally aligned bites, but sometimes orthodontics is just not the best answer. And I know that goes against what so many dentists say, but it is actually true. We're happy to talk about those things here at Simple Orthodontics, and we're happy to advise patients that sometimes orthodontics is not a good idea. So we always want to give you the straight answers here, and certainly reach out to us if you have any questions about you or your child's potential orthodontic intervention. We're always happy to answer questions here at Simple Orthodontics. You can follow us for more videos like this here on YouTube, Facebook, or Instagram. If you have any questions, feel free to reach out to our team. We'll be happy to get them answered. Until the next video, be well and smile more.